Bupropion and naltrexone are a fixed combination of two medications belonging to two different classes. This combination is well popular with its brand name Contrave. It is available as a tablet, and both components can control appetite centers in the brain. Therefore, using this combination as a weight loss medication is a viable option. Bupropion is a medication classified as an antidepressant. It is a new generation antidepressant that has multiple clinical uses. Even though it is primarily indicated for treating depression, it can also be used for other purposes. It can cause loss of appetite and reduce food intake. Similarly, naltrexone is a medication classified as an opioid antagonist. It blocks the actions of opioid analgesics, and it can be used to treat opioid intoxication. Naltrexone can also suppress food intake and help in weight loss. Therefore, a combination of these two medications can bring better control over appetite and reduce food intake. Excess body weight always poses a risk to the health of individuals. Overweight can elevate cardiovascular complications and even increase the risk of stroke. It can also put extra pressure on bones and joints. Difficulty breathing and respiratory complications are also elevated. Maintenance of a healthy body weight prevents many lifelong complications. People with a body mass index less than 30 kilograms per square meter may have fewer complications. When your BMI is above this value, you need a reduction in your body weight. Controlling diet and regular exercises can maintain ideal body weight. In people with existing risk factors like diabetes or hypertension, BMI may be better maintained below 27 kilograms per square meter. Weight loss medications help you achieve this goal in a better way. The bupropion and naltrexone combination is used to reduce body weight in people with a body mass index above 30 kilograms per square meter. In this video, we will explore key facts about this combination, like how they work, how they are combined, what are common side effects, how to take this medication, and what are the important precautions. How it works. Bupropion works on your brain to increase the levels of a chemical mediator called dopamine. This chemical mediator has wider roles on the brain, controlling many activities, including emotions and pleasure. It can also control appetite and energy consumption. However, the reduction of appetite is mediated through activation of another mediator called POMC, proopiomelanocortin. This mediator is a peptide that controls appetite centers in the hypothalamus. This is the presynaptic neuron that stores dopamine. On release, it can stimulate dopamine receptors on the postsynaptic neuron. These neurons are well connected with other neurons that release POMC, a mediator that controls appetite centers in the hypothalamus. Dopamine levels are highly essential to send the signals to POMC neurons. However, bupropion works by increasing the levels of dopamine. It blocks a transporter called DAT, the dopamine transporter that is actually responsible for uptake of dopamine. When this transporter is blocked, more amount of dopamine is available at the synapse, which improves dopamine transmission. This sends more signal to POMC neurons, which brings an enhanced control of appetite centers in the hypothalamus. This results in reduced food intake, helping in weight loss. It also promotes energy expenditure that adds to a reduction in body weight. Then what is the role of naltrexone? Naltrexone is added to bupropion to bring a more efficient control on appetite. In your brain, a few opioid peptides are released that can stimulate appetite centers. One such peptide is beta-endorphin. It can act on opioid mu receptors that prevent the actions of POMC neurons. This may result in increased food intake, leading to excessive body weight. Naltrexone can block the action of these opioid peptides. It can act as an antagonist at opioid mu receptors, thereby preventing the actions of beta-endorphin. This improves the actions of bupropion, leading to better control over body weight. How to take this medication. You can get both medications, bupropion and naltrexone, in a fixed combination as a single tablet for ease of administration. Each tablet contains 90 milligrams of bupropion and 8 milligrams of naltrexone. Bupropion can induce seizures if it is used at higher doses. Therefore, this combination should always be started at a low dose, and it may be gradually increased by weekly intervals. Initially, it is given as one tablet intended to be taken in the morning. After 1 week, another tablet is added in the evening. Therefore, on the second week, it is given as 2 tablets per day. On the third week, 3 tablets are given as 2 in the morning and 1 in the evening. Finally, on the 4th week, a total of 4 tablets are given per day in divided doses, 2 in the morning and 2 in the evening. It is the maximum dose, and beyond that, this combination should not be used. Taking bupropion beyond 360 milligrams is not recommended. Therefore, the maximum intake of tablets per day is 4. Never take more than 2 tablets at the same time during the therapy. You can take these tablets with food. However, try to avoid taking high-fat meals. What are the side effects? You can observe a few side effects like nausea, vomiting, headache, and constipation. Dizziness and insomnia are also observed. A few other side effects like dry mouth, weakness, upper abdominal pain, sweating, and tremors can also be observed. In a few people, this combination may increase blood pressure. You may also notice hot flashes and ringing in your ears. Long-term use of opioids. If you're using opioids long-term for treating pain, you should not use this combination. Since this combination contains naltrexone, it can antagonize the actions of opioids. Generally, opioids are used to control severe pain where NSAIDs are less effective. For example, opioids like oxycodone, hydromorphone, and fentanyl are used as analgesics. Opioids like tramadol are less sedative, and they are also widely used to control pain. On continuous use, your body depends on these medications, and you should not stop them suddenly. Therefore, while taking these opioids, you should not start the bupropion and naltrexone combination. Naltrexone can reverse the action of opioids, leading to withdrawal effects. Therefore, at least a 7 to 10-day opioid-free interval is suggested before starting this combination. In the case of long-acting opioids like methadone or buprenorphine, an opioid-free interval of the above 2 weeks is suggested. Naltrexone present in this combination can reduce the actions of opioids. Therefore, you may not observe full benefits of opioids while taking this combination. However, you should not increase the dose of opioids to get a full response, as it may lead to opioid intoxication. Risk of seizures. Bupropion in this combination may increase the risk of seizures in people with existing risk factors. People with recent head injuries, a previous history of seizures, or alcohol withdrawal may have more risk. To avoid induction of seizures, bupropion should be started at lower doses. Use of this combination may increase your blood pressure. It may increase your heart rate and produce rapid heartbeats. Therefore, monitor your blood pressure before and during therapy. The elevation in the blood pressure is mild and under control with usual doses. However, if you have a previous history of uncontrolled hypertension, this medication is not suggested to you. Bupropion is an antidepressant, and it can elevate mood and reduce the symptoms of depression. However, it is not able to control mood swings in the people. Therefore, this combination is not suggested for people with bipolar disorder. Like many antidepressants, bupropion can also induce abnormal thoughts and suicidal initiation in people. The risk is more pronounced in people under the age of 24 years. Therefore, caution should be taken to monitor any changes in the behavior in young people taking this combination. Angioedema. Even though rarely observed, a combination of bupropion and naltrexone may cause hypersensitivity in a few people. Swelling of the face, lips, tongue, and pharynx may indicate one of the hypersensitive reactions called angioedema. In such cases, you should discontinue the use of this combination. Contraindications. Since this combination contains 2 medications, bupropion and naltrexone, it may be avoided in a few conditions. Few conditions limit the use of bupropion, and a few others limit the use of naltrexone. As bupropion increases the risk of seizures, this combination should be avoided in people with existing seizure disorders or previous history of seizures. It is also avoided in neuronal disorders like anorexia nervosa, where excessive appetite is observed in people due to improper neuronal signaling. In such people, use of bupropion may increase the risk of seizures. Therefore, this combination should be avoided in anorexia nervosa. In people with opioid dependence or acute opioid withdrawal, use of this combination is not recommended due to the presence of naltrexone. Naltrexone can antagonize the opioid actions and can increase the severity of opioid withdrawal symptoms. These are the important facts about this combination of bupropion and naltrexone. This combination is used as a weight loss medication for better control over body weight. Both medications can be combined in a single tablet, and each one acts in its own way to control appetite and food intake. That's all, guys. Thanks for watching this video. Have a great day.